Acoustic waves are widely used in medicine. Cardiologists take advantage of the quality of angiogenesis, which is the creation of new blood vessels, and use that quality to treat patients with coronary artery disease. Orthopedic surgeons use acoustic waves to treat a variety of musculoskeletal disorders, taking advantage of the anti-inflammatory and tissue regenerative process of low-intensity shock waves. In urology, we've used shock waves for decades. However, the shock waves that we've used to break up kidney stones are 10 times stronger than the shock waves used to treat erectile dysfunction. An acoustic wave is a compression that's followed by a relaxation. The amplitude is the maximum displacement from a neutral point, and the frequency is the number of events that occur over a specified period of time, which is typically measured in hertz. Two different types of shock waves are used in the treatment of erectile dysfunction. There are focused shock wave systems and there are radial wave systems. The two systems differ in that they have a different shape of the wave and there's different levels of penetration. Euroshock utilizes radial waves. With low-intensity shock waves, there is the delivery of two different types of energy. There's a direct mechanical stress from the acoustic wave. But in addition, there is creation of unstable cavitation bubbles, which come about from focal points of vaporization. The cavitation bubbles collapse violently and create microjets. The microjets in turn tear open blood vessels, and this helps to spark the regenerative process. The cell actually converts this mechanical energy into a biochemical signal, and this process is called mechanotransduction. The cell channels open up, and there is a subsequent release of growth factors. From animal studies, we know that this transfer of energy results in a barrage of benefits that support healthy blood flow and erectile function. For one, there's increased circulation at a microscopic level. There's release of nitric oxide, which is a key signal in erectile function. Nitric oxide is something that helps support healthy blood flow. We know that there is the potential of angiogenesis, which is the creation of new blood vessels. There's reduced inflammation, and there can be a release of growth hormone, a promotion of nerve growth, and the recruitment of stem cells. Shockwave therapy can be a very appealing option, particularly for guys at the very early stages of erectile dysfunction. There's a ton of guys out there that are still able to get hard, but they're just not as hard as they used to be. Or maybe they're hard most of the time, but not all the time. And guys are in a situation where they can't depend upon having a great erection every time. Now, traditionally, men who were in that category didn't have a lot of choices. Most of them ended up taking PDE5 inhibitors like Viagra. And Viagra is terrific. It's been a fabulous drug especially when it was first introduced more than 2 decades ago. The problem with Viagra is that Viagra doesn't cure the root problem. It doesn't improve vasculature. It doesn't offer a cure. Shockwave therapy offers the potential of actually improving blood flow into the penis so that many men who found themselves dependent upon pills like Viagra no longer have to use those medications. And let's face it, while Viagra is sensational in the beginning, eventually it stops working. And the reason it stops working is not because of tachyphylaxis. It's not a problem with guys becoming habituated to the drug. The problem is that Viagra is asked to contribute more and more. As there is more vascular insufficiency, the Viagra is only able to do so much, and over a period of time, Viagra stops working. Look, if you're a guy in their 20s, you may say to yourself, I can't possibly have erectile dysfunction at my age. But international studies have shown that up to 30% of young men between 20 and 30 are experiencing some degree of erectile dysfunction. And I don't know if it's because of the stress of the pandemic or that guys are more comfortable expressing their vulnerabilities, but even among young men these days, having some problem with erectile dysfunction is not unusual. And low intensity shock waves may be the ideal treatment for patients in this group who don't want to have to take medication. If you're a guy that's already taking Viagra and are responding to it, low intensity shock waves might allow you to get off the pills. If you're a guy who's not satisfied with the type of erections you're getting with Viagra, again, low intensity shock waves may not rid you of the requirement to take the pills, but it might allow you to have better erections while you do take them. I also want to take a moment to tell, unfortunately, some patients aren't going to respond to this type of treatment. For instance, if you're a patient that hasn't been able to get an erection in 10 years, you probably should look elsewhere for treatment. And similarly, if you're a patient that suffers from erectile dysfunction secondary to pelvic surgery, such as radical prostatectomy, low intensity shock waves are probably not your best option. What sets Euroshock apart from the competition? Number one, with Euroshock, you own the machine for a fraction of the cost of what doctors charge for treatment in their office. You own the unit. One of the unfortunate consequences of low intensity shockwave therapy is that most patients will require retreatment down the road. So the low intensity shock waves provide a benefit, but that benefit tends to fade over time. With Euroshock, you own the system. So whenever you need a touch up, you just use your own Euroshock to retreat yourself. The Euroshock is compact, it's reliable, it's much quieter than other units. Our units are sleek, they're high tech. If anybody ever sees it, you won't be embarrassed by it. Unlike other units on the market, Euroshock is fully rechargeable. There's no cumbersome, awkward cord. We've used medical grade components, including a brushless motor and comfort controls. Finally, we offer a 30-day money-back guarantee. So if you purchase a Euroshock and for any reason you're not thrilled with the outcome, you can return your unit and we'll be more than happy to refund your payment. Thank you.